So I want to talk about the new hot option for PCOS, the new hot doctor's option for PCOS, besides metformin, birth control, and spironolactone, which we all know have their terrible side effects. The new thing is weight loss surgeries, so bariatric, lap band, gastric bypass, any of those, they say. My doctor told me it can cure PCOS. So, I wrote down a list of the pros and cons, and I'm going to read some of them to you. Pros. There is a link between PCOS and obesity, like the severity of PCOS and obesity. So, the fatter you are, the worse your symptoms are of PCOS, if anyone hasn't figured that out by now. So, weight loss surgery will make you lose weight, which will obviously in turn lessen the symptoms of PCOS. And then it says that it will restore your period. It will restore the ability to conceive within 3 years. I don't know what the statistics are on that, but that's what I'm getting from all the research I've been doing. It says no more hypertension, which is high blood pressure, no more of that. It relieves insulin resistance, which a lot of people think is the root cause of PCOS, so that in turn could relieve a lot of your symptoms. And cysts and acne on your skin will go away, as well as cysts on your ovaries. So then I did some research and I tried to find out some of the bad things about gastric bypass and surgery, and I found out that the cons: women with PCOS who get gastric bypass surgery are still experiencing hirsutism, which is unwanted hair growth on females in places where they don't usually get it: chin, face, chest, back, stomach, butt, wherever. And if that's your, main symptom that's really bugging you, gastric bypass is not going to help you. And then here, saggy skin is another big concern of mine. I don't want this, hanging, saggy skin. And, most people, if you lose a substantial amount of weight, if you're as overweight as I am, you're going to have this, gross, saggy skin. And eventually you'll probably have to go pay for another massive surgery to get your skin tightened. And then here we have more hair loss. So lots of people with PCOS have terrible hair loss. Lots of people with gastric bypass have terrible hair loss, even more. So if that's one of your options, I wouldn't go with this either. Here's a picture of some skin, or let's see here, some skin after gastric bypass. That's after she had the surgery. This is what your skin is going to look like. And here I have hair loss after gastric bypass. See here? Look familiar, any people with PCOS? So that's not going to help you. And then here I have scars after PCOS surgery for gastric bypass and tears and stuff, and it's not pretty. You have to have these things where tubes stuck in you and they leak, and it seems very terrible. And let's see here. And then also there's risk of internal bleeding, anal leakage. You will be doing lots of vomiting. You will get a sickly appearance. You'll have to eat soft foods for a very long time. You can't overeat at all or you will get sick, and that will happen a lot. You need high calorie diet to survive, so you're going to be eating little amounts of high calories, and that's going to be different. Also, let's see here. You'll have to take supplements for the rest of your life, which, I do anyways for my PCOS, but it seems like you're going to have to be taking them, or, you know, your life is at risk. You know, you can't just forget like I do. And then the dirty little secret of the bariatric surgery community that I've found from some of their forums and stuff is that this huge thing that people get afterwards is body dysmorphia, anorexia, and bulimia, and rumination. So I looked it up, and it's all over the internet. Gastric bypass, anorexia after gastric bypass. So, and that's all over. This girl had gastric bypass. Now she's anorexic. See, she still has the scars from gastric bypass, but she's considered anorexic. And so those are the cons. And personally, well, I had carpal tunnel surgery about 6 months ago, and it was such a horrific experience. I woke up in the middle of it, and they had to give me more anesthesia, and I was freaking out, and it was so terrible. And afterwards, I was so irritable, and on pain pills. I'm just not even a nice or pretty person, and I know that I could never go through any type of elective surgery like that without, you know, it being like life or death. And I feel like right now I can just try to lose the weight on my own. Unless it was like life or death, I don't recommend the surgery. And then I went to my general doctor. This is my PCOS doctor, who's, every time I go, all he wants to talk about is gastric bypass. I can't talk about vitamins, diet, or anything. It's just gastric bypass. And he's even referred me to the people and tried to make me make appointments and everything. And so I went to my general doctor and told her, and she was like, ooh, she goes, I don't like that surgery, and told me that she wouldn't do it. So that's what I have to say about gastric bypass surgery and PCOS. Thanks.